welcome to this segment of Community Talk. I'm Bobby Donaldson, and here with me today is Karen Staples. We're going to try to talk to you a little bit about gifts that are appropriate and challenges we see with gifts for the seniors in your buying list. We're going to talk a lot about gifts that go to the nursing homes because, as everybody knows, I'm an old nursing home person. Karen works still. Cherokee Manor has kind of worked hard to put together what their residents need or would like or what benefit them. So let's start there. Karen, tell me how it works if my grandmother lived at Cherokee and I lived in California.
Well, there are a couple of ways that you can do that. We will help by shopping or getting lists or helping them do things if they would like to call. We can give them suggestions for things that we might be able to pick up for them. Or if they have something specific, they can do that. And generally, we have a list of things that are appropriate for the nursing home setting.
Well, and what you need to do is if you are regularly involved with this family member, you have an idea, or this friend, of what size they wear, what colors they like, or what appropriate clothing. If not, you need to talk to someone who is a caregiver or routinely involved with them.
Right.
So we're going to go through here a little bit, kind of a list that we made up. The majority of the things on here are people who might be in a nursing home or in an assisted living or even in a senior independent living.
Right.
Small space, maybe housekeeping coming in, which makes it safety an issue. But one of the things that my family made for my mother when she was in independent living was we called it a letter box. Right. And we just bought a box, like a pretty box at Walmart or Ross's or some store, with a lid. Mm-hmm. Now, it's really nice if you can find the one that the lid's attached and just folded over. But if not, the other kind works. And in that box, we put stamps, writing paper, some various cards, sympathy cards, birthday cards, thank you cards, some little note cards that just wrote on, a couple of pens, a couple of pencils, a magnifying glass with a light in it. That's a regular magnifying glass helps as we age and it's hard to see. But the little light, we found that one of the things that seniors really like is to read the newspaper, especially from their small hometown. And the print is not bright white on the newspaper. And so the light made it a lot. My mother was very excited when she could see to read her newspaper again.
And that brings up another good gift for someone who is away, is a lot of times they will like to have a subscription to their hometown newspaper because it allows them, it comes right to them, it allows them to keep up with their friends and with the things, and that's a treasured gift that we found that they like.
Well, and if they live in Cherokee, there is a paper. Yep. And if they're from Alfalfa County or from that area, they want to read the Cherokee paper too.
Right,
it's fine to send them the Enid paper or the Daily Oklahoman or something that's larger but that little newspaper that tells about their friend's great-grandson scored 6 points at the basketball game, that's what they're looking for.
Yep.
Anyhow, this box is you can kind of judge for your own self what's best to put in there, but it just gives them a chance to go to one place and keep their writing supplies, because we're talking about a generation of people who communicated through the U.S. Postal Service still and send a thank you note and, no, they're not Facebooking you or that kind of stuff. I have some gifts that we have made that in my family with memory things. When my daddy passed away first, I took his favorite shirts and made them into little teddy bears. And we remembered those shirts. Remembered Daddy sitting at the table eating breakfast. So that little bear hanging on the wall, my sister says some days that's the nicest thing I see all day, which I don't know if that speaks to the rest of her day or not. But also I have a sweet bracelet, and it's made from buttons. My husband's family were railroad people. His grandfather drove a train. His uncles worked on the So I have buttons from like conductors and stuff with beads in between them. And they made this bracelet. And one of my little nephews, when he was about 2, brought this to us. And it's different than something you buy at the store or whatever. There is a wall hanging that I have. Anybody who wants to know about this stuff can call the number on your screen. I'm not good with numbers. It's big. And it's a quilted fabric on a dowel rod. And sewed to it are clear plastic pouches. And you just slip the pictures in. It hangs flat against the wall so it doesn't get broke. It doesn't need dusted. The pictures easily come out the top. It's one of our favorite finds. If they're still active and they go to, of course, the Gaslight, we both love the Gaslight and know that the theater has wonderful plays we're doing. It's a Wonderful Life for the Christmas play, and my husband and my granddaughter and I are all in it, so that's very exciting for us. But we have a lot of seniors who really enjoy the plays, and because locally at least we have an afternoon performance, you know, it's not quite so late. And, I don't know if you want to, go through part of this?
Right. One of the things, of course, I am geared a little bit more towards the nursing center, and there are various restrictions on what level of care that you're in, but I know when you're in a nursing center, there are certain things that you need to visit with the social service or the administrator about. You can't have aerosol cans. You can have pump sprays, but you can't have aerosol cans. And there are just certain restrictions. If you're going to put a candle, these new flameless candles that glow and look like candles,
no fire.
but no fire. So, you know, it's just a good, good thing to check and do that.
Well, and there is an inventory sheet in a facility, and in that inventory sheet are the things that are there. So if you're the family and you're bringing in a new coat or a new slacks, if you're taking something, please adjust that inventory sheet, and please help the cleaning people, even in independent living everywhere, because as an old person, I can tell you we don't like to throw stuff away. We might need that. I know it doesn't have any buttons and it has a big stain, but I might need it. But I have this little bitty closet, so sometimes if you can take things, whether you're going to store them or whether, we don't want anyone to ever think they can't have their stuff anymore. Right. And so if you can help figure out how for stuff that's in the way not to be there.
Right.
Am I telling
that well? Yeah, definitely, because a lot of times the space is very limited. And so if you can kind of rotate things out, even by seasons, if you're here where you can, it's a great help to them because it allows them to have more of their things without the restriction.
Well, and storage is at such a premium.
Definitely.
And anything that makes clutter is a risk. It's a risk for a fall. It's a risk for cleanliness. It's just a risk for clutter. My children wish we could figure that out at my house. One of the greatest things that you can do almost anywhere that your people receive service, even if they live at home, is if they go to if you have a lady that goes to the hairdresser, approach that hairdresser about a little gift card. If she doesn't have them, make something up. Go on your computer, make you a little, and pay for a few, because I can tell you we all like to get our hair done.
And a lot of the facilities have an on-site beautician.
Most of them.
And it's very, it just brightens their day. It makes them feel better about themselves.
Okay.
It's a great pleasure.
We're going to talk just a minute about please don't bring or buy, or even in their own homes, if you can try not to promote heating pads, the amount of damage that can be done there.
And in a nursing center, we just have to take it away from them. So, because it's not only unwise, it's against the regulations by the state. So.
Well, and those regulations got made based on that people became injured.
That's right.
They simply can't feel, I don't feel the heat as quickly as my child or as I did 25 years ago. And with my circulation being poor, it's just, it's expensive things that break. These are, think about, probably one of my favorite gifts on this list I want to tell you about. If you haven't seen one, please just go to a store. All the stores, Kmart, Walmart, Walgreens, Sears, all those stores have their books. My particular one is The Christmas Story. and it has a little recorder in the book. So my children got my grandchildren together and pressed a button, and in divisions, they read me the original Christmas story, page by page. So I can take that book and see the pictures and see the writing, but their little voice reads me the whole story. Now, no matter where you live, you can do this for your parent and send it to them. The other thing is, if you have someone, say here, who has a new grandbaby or great-grandbaby in Florida, if you can get with them and their abilities are such, they can go read that book and you can send it to that child. And I promise you, it's one of my most precious gifts.
Yes, it really is.
That little voice is so sweet reading that story. It's a great gift.
Very definitely.
Of course, we always have to say that the best gifts are time.
Oh, definitely.
So if you can come, do come. If you can visit, do. Let's talk a minute or two about respite care in the facilities for people. Lots of couples, one is caring for the other one.
Right.
And they need to shop, or they'd like to go to dinner or to the grandchildren's Christmas play. See? Or even maybe to the children for a long weekend.
That's right. A lot of times, like you said, one of the couple is a caregiver, and for them to be able to go to where their children are at, or go to visit them, or have a day, or sometimes several days out, they need a safe place for that person to be cared for while they're gone. And most of the facilities, ours does, and most all facilities, have some sort of respite program or adult daycare program that they can do. And if they want to call that number and need advice on where some of those are, we could give them that. But it's a great thing to have, because often the caretaker is just worn out.
They forget to take care of
They forget to
themselves,
take care of themselves. They certainly.
So if you call us, we will tell you about respite. I can tell you my daddy had a surgery one time, and they live in a small town, so he needed to stay here for a week while the staples were waiting to come out. So he stayed in the nursing home where I was working at that time, and we bought little note cards and wrote, "At the nursing home, having a great time, wish you were here," and sent them to people, which was really fun till his college roommate called me and said, "I can't believe your mother put your dad." I said, "He's visiting. My mother's on a trip, you know."
Yeah.
And so he came out and played checkers with Daddy. And but sometimes a break is the best gift you can give someone. So if one of your parents is caring for the other one, or if one of your siblings is caring for your parent, or you're in one of those venues like that with a different relationship, consider that maybe a few days respite is a gift you could give that caregiver.
That's exactly right. That's exactly right.
And I just, the holiday season is everything. We care for a generation of people. I am a generation of people who we love the holidays. My family says very few people love the Christmas more than me. But my husband says I can't put the Christmas tree up this week, so maybe later. But it's a chance. The Thanksgiving, of course, is a family time, and we are thankful for so very much. And then the holidays. So if you're struggling, or call your facility, call your caregiver, sit down and say, what would you like? You may be very surprised at what they would like.
They will definitely help you.
And instead of just, buying 14 picture frames and send them one to this person and that person, be very careful about a couple of things. Foods, talk to someone, be sure that you're not sending an inappropriate food. And scents. If you have an illness that is related to anything respiratory, anything like that, strong scents are, and you see all the pretties, the nice perfume or the bath oils, you just have to be very careful that the respiratory people struggle when they get involved.
Yes, they do. And there's usually a lack of storage, so not something that's real perishable or that would, be inappropriate to keep in the room.
And so I just, I want to wish you a Merry Christmas. And for those of us who have cared most of our life for our seniors and been blessed with this great work, it's a fun time to share. We know don't send a crystal vase because we've swept up a crystal vase in our lifetime. We've known don't send a candle because we've had to explain to a lady that the beautiful candle from her granddaughter is disallowed by the state because it's an open flame. And so what we hope here is that they actually get something that doesn't break the rules and that they're allowed to have. And I just want to say Merry Christmas to everyone from Karen and I.
Yes.
And to everyone who's ever trusted a loved one to us, we'd like to thank you for that trust.
Hi, I'm Julie Nelson with Hospice Circle of Love. We're a not-for-profit organization that helps terminally ill patients make every day count. We have a team of caregivers that comes into the patient's home or nursing home and provides pain and symptom management, emotional support, and spiritual support, among other types of help. And today we want to tell you about an upcoming event called the Tree of Life. And I have with me our bereavement coordinator, Kevin Strope. Thanks for being here today.
You bet.
Let's kind of explain how Tree of Life helps patients and families. We remember loved ones at that. That's kind of really the focus of it.
Memorials, rituals, going through those kind of things really helps a person make some progress, to look back with good memories, and to celebrate and to give thanks. And so there's just all those little things help. And that's what we do, is just try to help people to make the next step and to remember and to celebrate the lives of their loved ones.
And of course, we'll be automatically remembering all of our patients that have passed away in the last year at this event. And then other people from the community can participate as well by purchasing an ornament in their loved one's name. And the ceremony itself will be reading all the names of those we're remembering. And I think that's a really big part of it, don't you?
Oh, I think so. Just remembering and giving honor where honor is due, and it's special to hear the names of your loved one. And then the short spiritual message is always an uplifting, hope-filled message, and then a lot of the family members like to reconnect with their nurses or some of the staff, and we have people that come back year after year sometimes.
Yeah. And this year's Tree of Life event is going to be December 7th on a Sunday at 3 o'clock. It'll be at the Gantz Center out at NOC in Enid. And in addition to reading all the names, we will also have some Christmas music. And you mentioned the spiritual message. We will have everyone there sing Joy to the World together. And of course, we can't forget the cookies and punch.
Sure.
The reception afterwards. That's very important. And that's when people have a chance to kind of reconnect with the staff members that came into their homes and helped take care of their loved ones. So that's really nice. And then, of course, we encourage people to take the ornament home that has their loved one's name on it at that time.
Well, I think a lot of people are just blessed by it, and it seems to be something that helps to make it through the holidays.
Yeah, and the focus while we're having that event will be the trio of Christmas trees that will have the ornaments that contain the names of all the people that we're remembering that day. And so I wanted to let everyone know that we'll have silver bells this year with a leather strap, and that will have a name tag on it with the loved one's name. And if someone isn't included in the family members that we're putting on there for free from the last year and they want to purchase an ornament, that's $25. And they can stop by the office anytime to get that ornament. And we also sell duplicates, which people have been taking advantage of the last few years. And those are $10. And that way, if you have several children, you can get an ornament with the same name on several ornaments, and then everyone can have one to take and put on their own Christmas tree.
Sure.
And I wanted to also talk a little bit about some of the other things that you do with our bereavement program at Hospice Circle of Love.
Well, it's just our privilege to be a part of the community and to help anybody who wants to come by and just visit for a few minutes. We have people who come by that we have not even had a chance to serve, but they heard that we have grief services, and so all of our services are open to anybody in the community that has a need, and so that's a privilege to be able to help people, and in that time of need. And we have all kinds of great resources all the way from kids to adults. And there's so many unique situations that are out there. And so we've been afforded some expertise and some experience that we want to make available to anybody who might need it, because I don't know if there's anything harder than grieving the loss of somebody that you love. And when you lose somebody that you really love, it just really hurts. And we've found that just being able to talk about them and to tell your story, and a lot of times I just listen. And so if that helps, and then we'll have another grief group coming up in February. We want to get past the holidays.
Yes.
And then every Tuesday in February from 5 to 6 in our conference room, we offer a free grief group. And I don't know of any other in town. And so we open that up to anybody that would like to come to a grief group, and it's free. We have some good resources, and a lot of times people just connect with each other who've been through similar losses.
Right.
And that helps. We have people stay after grief group and just visit because they help each other, because they have something in common. So that's just been a huge blessing to be a part of.
Yeah. And we also have a licensed counselor that we can send to someone's home to visit with them if they need that as well.
Sure, you bet.
And your booklets that you have that you can send.
We have an array of booklets and services, and there's so much online that we could point people towards. And so they're just, we have tons of resources and helps.
And going back to the Tree of Life, it's hard to believe, but this is going to be the 25th year that we've had that event.
Wow. Yeah. I think it just gets better every year, and more people, and it's just a meaningful, helpful time.
Yeah. And we talked about some of the things that were going to be going on during that event. The person that will be doing our spiritual message this year is Rusty Mosley with Westminster Presbyterian Church, and we're going to be having a couple of Christmas songs by the Rhythm Country Ministries. And then we talked about how we'll have the names read of everyone and the cookies and punch, and everyone will be able to pick up their ornaments at that time. Another thing I wanted to mention is that this really does focus on being a bereavement activity, but it's a fundraiser for us as well. So that money will go to help our patients that don't have a Medicare or a hospice, or insurance benefit for hospice.
Right. And I think that's one of the things that is just another blessing of being a part of this organization is we get to help a lot of people who don't have any funds.
Right.
And unfortunately now we have more people who are younger, and that's sad, and that's hard that people are dying younger. And so it's really a great honor to help somebody in that time of need and to relieve a lot of stress and pressure. And in my family experience growing up, our family was really helped out by hospice, and I was surprised by all the different services and all the different levels of help, and just have all those extra hands and extra expertise and insight was just a relief to our family. It was just wonderful to have that available.
A lot of times families will say they wish they'd called sooner because it is so much help.
Right. Wish everybody knew about it.
That's
but,
right.
We'll just have to keep getting the word out.
Yeah. We've talked a lot about the bereavement services. Let's talk about some of the other services that hospice provides to the patients and the family.
We have a great chaplain, Gary Miller.
Yes.
It's phenomenal how he connects with people. People just warm up to him, and he anybody who might be scared of having a chaplain come by, he takes away those fears in a hurry. And pet therapy, music therapy. It's amazing.
The nurses.
Oh well, yeah. That's the best part. And they go the extra mile, which I mean they really care and get involved in the lives of the family. And our aides are just the best in the world, and been doing it a long time. And I'm blessed to be a part of the team.
Oh, and the social worker, of course, is also very important.
Yeah, anybody has any questions, she has the answers.
Yeah.
She has lots of connections, and And that's another amazing facet to think about, all the
Yeah.
services that are available that people don't know about.
Right.
And so she brings a lot to the table as far as information and connections.
I know recently she helped someone connect with a family member that was serving in the military overseas to get a phone call through the Red Cross, and does a lot of those kind of things. Helps people kind of finish the things they need to finish.
Right. And people are dealing with so many issues and questions and stress. For somebody to come in who's able to see what needs to be done and to offer that extra help is just a phenomenal service.
Okay. Well, once again, I want to mention that our Tree of Life celebration is going to be held on Sunday, December 7th. It's out at NOC at the Gant Center, and everyone is welcome to come and be a part of that great event. If you would like to purchase an ornament, you can come by our office anytime at 314 South 3rd and make a $25 tax-deductible donation for that. And you can always check out our website at hospicecircleoflove.com or give us a call at 234-CARE if you have any questions about hospice. Thank you.
Hello and welcome back to Community Talk. I'm Shailene Jones, Marketing Coordinator for Leonardo's Children's Museum, and I'm here interviewing Julie Baird, Leonardo's Executive Director.
Hi.
Hi, how are you?
Good.
So tell me the things that have been going on at Leonardo's. What's been happening?
Well, you know, every month we always say we have so much going on. November is kind of a quieter time at Leonardo's as we wrap up some of our educational programs and get ready for the second semester. But it's the time that I always like to stop and count our blessings. You know, we do that as a family. I was one of those moms that made my children go around the table and say one thing they were thankful for.
Yes.
And I like to do that at Leonardo's because we have so much to be thankful for. We have wonderful volunteers and members and guests and a great team and a visionary board of directors.
Yes.
You know, we just have so much to be thankful for over there. And we always have. It's hard to believe that we're now in our 20th year.
Wow.
Leonardo's turns 20 next summer.
That's exciting.
And we'll be talking about that some in the months to come. But right now, I kind of wanted to talk about our annual campaign. This is something we do every November. It's where we raise money to help support our scholarship outreach programs for the next year.
Okay.
And the really cool part about our annual campaign is that for the last 4 years, Park Avenue Thrift has matched all donations to Leonardo's from from November 1st through January 15th, up to $30,000. So when they match that, that means that's $60,000 we can use next year to provide museum visits, camp scholarships, family memberships for low-income children and families in our community. And I'm just so grateful for that. I know you are still relatively new at Leonardo's, but that's kind of been my soapbox for the almost 10 years that I've been there.
Okay.
Is why have this one-of-a-kind children's museum and the world's largest community-built outdoor playground in Enid, Oklahoma, if the children that need it most never get to visit?
I agree.
So we're always looking for ways that we can fund scholarships for children. And you know, there is a cost attached to each person that comes in the door. We have to have art supplies, science supplies, wood for the carpenter shop. You know, we want electricity and heat and running
Yeah.
water and nice clean restrooms, and so there is a cost attached. And so the way we can provide those scholarships for children and families is for other people to make donations to us. And all donations to Leonardo's are 100% tax deductible. We're a 501c3 nonprofit, and so we just use this time at Thanksgiving to say we're thankful to you, and hopefully our community can continue to support our efforts so that we can give back. In 2013, the last year we've had an annual report done so far, Leonardo's gave over $85,000 in programs and services back to the community, and that's because it comes from the community. So we want to say thank you for that.
Yeah, well, it seems like there's definitely a ton of support there, and people are always looking out for ways to reach out to Leonardo's and be involved. Now, I know that campaign gets confused with the capital campaign.
It really does, because we have been hitting the capital campaign so hard lately. As many of our viewers know, we recently received a $1.5 million grant from the Donald W. Reynolds Foundation, and it was supposed to be that we had to raise $1.5 million to go with that, but we ended up doing that because of our generous community before the application even went in. So that means we were more than halfway to our goal. As of right now, we're $3.3 million in for a total $6 million project. And that project is to completely renovate and expand the museum. I like to say it's to fully use the space. Right now, it's 10,000 square feet per floor. We only have the museum on the first floor.
Yes.
Second floor, we have our offices and a big room that has been used for company parties and wedding receptions and things, but we want to expand the museum to 2 floors, give children twice as much to do when they're there. And then the third floor, the other 10,000 square feet, was never finished. And so we want to move our education up there. Right now we do summer camp, 8 to 10 weeks of summer, and it's all out in that big room, and so noise is really a problem. When you have 3 or 4 classes with 15 to 20 children each going on at the same time, then it's really hard for the teachers to be heard. And so we want to finish that third floor space and make it a true education center with an art wing, a science wing, 2 other classrooms. It's really going to be wonderful. And the other thing that I love, that our architects, and we're using John Mers from the local architectural firm of Corbett and Mers, but John had this idea to move the entrance to the south. Right now, when you get out in the parking lot, you have to cross the street and go around on the west side of the building where the stairs are and the ramp.
Yes.
And we're going to move that entrance down to the south on Maple.
Oh, wow.
And then we're going to pull those stairs and ramp off and have additional exhibit space.
Perfect.
And so I think that's going to be really cool. So we're really talking about more than 30,000 square feet. It's more like 31,000.
Okay.
And so it's going to be really great. If people would like to hear more about that, they can call me at the museum. But we do have a lot of pledge cards out for that too.
Yeah.
And so we're getting a lot of confusion. Somebody will send us a check that says to Leonardo's Capital Campaign on an annual campaign return card.
Okay.
You know, as long as you're supporting Leonardo's, we are
Yes.
very grateful. If we're confused, we're going to call you and ask you. Sometimes I'll get a check and it just says Leonardo's, but I know this is somebody that one of our campaign team has been talking to, so I'll call them and say, just want to make sure,
Yeah.
which one does this go to? And it is difficult. We're asking people to sponsor 2 things at once. But we really believe that Leonardo's has had a great first 20 years, and we want to be here for at least 20 more. You know, those exhibits that we have in the museum, we have a few new ones. We have our traveling exhibits from the Oklahoma Museum Network every 6 months, and we opened our new tinkering exhibit in 2013. But the rest of it, it hasn't changed since the museum opened in 1995.
Yeah.
And so we like to say it is much loved.
Very.
And just like in the Velveteen Rabbit, you know, when you love it enough, it becomes real. But it, you know, it's starting to look dilapidated in certain areas, and we just want it to be a quality, hands-on museum that people will love to come back and bring their children and grandchildren to for a long time.
Well, it sounds like you guys have been working hard and gathering up as many donors as available, and so I know the Enid community has been a great support system. And so what else has been happening at Leonardo's right now?
Well,
what more are we working on?
We're getting ready for Thanksgiving. It's hard to believe that that time is approaching, and we just want to remind our viewers that Leonardo's is closed on Thanksgiving Day, but we will be open when the kids are out of school on the day before Thanksgiving, Wednesday, and the day after on Friday, and of course Saturday and Sunday. The only day we'll be closed Thanksgiving week is the actual holiday. And when we have those kinds of vacations from school, we like to have some special activities for kids. There'll be some art and craft activities. There'll be some special science. I think our operations manager, Josh, was talking about how he wants to get out the electronic circuitry board, and so he's going to have that available during those days. So lots of things to enrich and inspire children. And so if Grandma's cooking, she can send Grandpa to Leonardo's and let the kids run off some energy, and then they can come back when everything's ready to go. But we like to do those kinds of special things during the holidays. And also, as I mentioned earlier, we're kind of wrapping up our first semester of our educational classes. We do the Highland Partner Science Adventure Club on Tuesdays and Thursdays, and that'll go one more week for Tuesday group, but a couple more weeks for the Thursday group, because we won't obviously have class on Thanksgiving Day. And so it's now time to enroll for second semester. And we have those enrollment forms for both Science Adventure Club and our Tools for Homeschool groups. Those are Friday classes that we do I guess Science Club is for 4th grade through 8th. Homeschools is for age 4 through 12, or about that age. You know, the parents are the best judges of what grade level their students are working on. But it's time to enroll for that for second semester, and we offer a discount in December for that. So the early enrollment discount goes through December 31st, so you want to be sure and take advantage of that. Another thing we really push for the month of December, and I know we'll be back next month and talk about some of this again, but we do a membership drive in December. And so for all new and renewing members, these are any of our family memberships. There are 3 levels of that. You can get a 10% discount if you renew or purchase your membership during the month of December. And so as a grandparent, you know, that's something I always think of for Christmas presents. Parents are looking, you know, sometimes if you're a grandparent that lives here and your grandchildren live out of state, you don't know what to get them. Or maybe the grandchildren live here and Grandma's just asking, what could we get them? I know we have a lot of military families that love to use our facility. And so maybe if you could you know, they could tell their parents about this would be a great gift idea, and we'll send them a little gift card that they can open. And that's something that the kids will enjoy for the entire year, unlimited visits. Another thing we talk about a lot is teacher gifts. You also don't know what to get for those hardworking teachers. So why not give them a class that your child and all the students in that classroom can enjoy, a free art or science class. And we'll go to the teacher's classroom, or she can bring the kids there. You know, she'll pick the date, or he, sorry, gentlemen. And, you know, and so those are just some great gift ideas that we have during the month of December. We also have quite a lot of new toys in our gift shop. And I know you said we're running a Black Friday sale.
We are.
So that'll be cool.
Yes.
But also there's a lot of educational toys that you can get there and get a good price on them and be supporting Leonardo's that way. So there are lots of ways you can support Leonardo's at this time of year.
And a lot of them are everyday items that you can go purchase from the gift shop to support Leonardo's, and everyday donations and contributions. And you can donate a lot more than just money. You can donate your time, you can
Sure.
volunteer
That's
and
a good
help
point.
out with groups, but definitely the campaigns are what we're working hard for, because that will benefit everyone in the long run.
Well, and sometimes parents like to teach their children that Christmas isn't just about getting, it's about giving too.
Yes.
And so sometimes we have a wish list is that on our website? You're the one that does the
We'll soon get a
website.
holiday wish list up,
And so they may want to choose to let their child bring
Yes.
us in a gift, some supplies that we need.
Well, that's all the time we have today for Community Talk. If you need more information about Leonardo's, visit us online at www.leonardos.org or give us a call at 233-2787. We'll see you next time on Community Talk.
Hi, I'm Kate Jeffries with the Oklahoma Healthcare Authority, and I'm here with Nico Gomez, the CEO of the Oklahoma Healthcare Authority. We're here today to talk about Insure Oklahoma, a low-cost, state-based health coverage option for low-income working adults. Since 2005, thousands of businesses and individuals have relied on Insure Oklahoma to help meet their coverage needs. Nico, can you tell us a little more about this program?
Well, we're very excited, very proud of what Insure Oklahoma has provided to the state. And we're very excited. It's our 10-year anniversary coming up next year. And it's a program that has helped many businesses provide insurance to many workers across the state. And it's a premium assistance program that actually helps people buy health insurance. And maybe, a Blue Cross Blue Shield or an Aetna or a private plan, but it's a way to help bridge the gap for low-income workers to access health care.
How many people currently use Insure Oklahoma to have a health insurance?
Well, right now we have under 20,000 people, and what that means to us is we actually can afford thousands of people to come into this program, participate. The message I like to send is Insure Oklahoma is still open for business. We haven't marketed it in a few years, and so now we're wanting to let people know that we're available and it's open as an option for really businesses with 99 or fewer employees, and many families can participate.
So families are eligible as well.
Yeah, well, now with Insure Oklahoma, the way it works is there's two programs. There's the employer-sponsored side of the program. So if you work for an employer that has 99 or fewer employees, that employer can choose to participate in Insure Oklahoma. And what that means is if their income meets the guidelines, we can actually help them pay for that insurance premium. And so what happens is we actually use the federal Medicaid program to help us, and state tobacco tax dollars to help offset that cost. And so with the program, we can use funding, state and federal funding, to pay 60% of the premium. The employer pays 25%, and the employee pays 15%. So it really does help make the cost more affordable, not only for the employee, but for the employer, and potentially their family too, because a spouse may qualify, and if they have kids, their kids may actually qualify for Sooner Care. And so it's an opportunity to get health insurance coverage for many more Oklahomans who may be working but uninsured.
And the affordability of this program is so important. We've recently done some surveys for members who have Insure Oklahoma, and I just kind of wanted to read some of the comments that we've heard from them, because a lot of them say they wouldn't be able to afford health insurance if it weren't for Insure Oklahoma. One employer said, one of my employees said if she didn't have Insure Oklahoma, her husband wouldn't have coverage. They wouldn't be able to afford it.
Right.
Another said that we couldn't afford insurance without it, and the employees couldn't either. And another said it allows families to get deeper coverage. But beyond offering health insurance to your employees to improve their own health, are there any other factors that employers should look at when they're considering offering health insurance?
Well, back when we were talking about creating this program, it was meant around, we had a large number of small businesses in this state, and we also had a large number of uninsured working Oklahomans. It was just unaffordable, really, for many businesses to provide, and unaffordable for many employers to provide on their own, to buy on their own. So this really created an opportunity to bridge that gap. And so we got really creative and innovative, and we brought many public and private partners to the table. We said, let's rethink this. And for the most part, Oklahoma's been a leader in this from across the country, and trying to find just kind of out-of-the-box ways where it's not just a government solution, but a solution that both business and government have joined together. So with that, actually, businesses were a part of the creation of this. So they actually had a part in its development. So a couple things that the businesses need to understand is this is an opportunity for all their employees, because they can offer group insurance to their, they'll get help for some of their employees depending on the employee's family size, and some of their higher income employees will have access to better group insurance coverage. So there's a lot of benefit for everybody. And what the employee gets, the employer, the benefit that the employer gets, obviously the affordability piece, so they can actually take some of their revenue and reinvest it into the company, maybe hire more employees or give employees raises. So there's an opportunity to reinvest those savings. But more than that, they're getting more productive workers. We've seen a reduction in absenteeism. We've seen better morale, so employers are seeing happier employees because now they have a healthier, happier workforce. And really, that from an economic standpoint, that improves your bottom line, because then you have an opportunity to really do some special things. And so we're very excited about it. We want to make sure that people understand that it's still available to them today.
Absolutely, and that is so important. You mentioned group health insurance. From the employer standpoint, is Insure Oklahoma the insurance company, or do employers have the option to choose a health plan for their employees?
A great question, Kay. So on the employer side, when they come to our program and say we're interested in participating, they actually get to choose from hundreds of plans offered by many healthcare providers insurance companies that are going to be very familiar to them. The Blue Cross Blue Shield, the Aetnas, the Community Cares. We use really what I consider the off-the-shelf insurance product that's available to every other business today. So they're going to get something that's very familiar to them. We also have an individual plan. So maybe we have an employee, a working Oklahoman, who doesn't have access to their employer because their employer just simply doesn't offer it, but they work for an employer that has 99 or fewer employees. So we actually have, through the Oklahoma Healthcare Authority, a benefit for them as well. It's the same kind of structure. They have responsible for 15% of the premium, but then the program is able to pick up the rest of it, and we're able to connect them with a network of hospitals and physicians and pharmacies to make sure that they have access to healthcare too.
Are there any certain groups that the individual plan targets, in addition to folks who can't get insurance through their employer?
Right. So if you're an individual and you maybe work for an employer that doesn't offer insurance because they just simply don't offer it, that's one group. But we also, if you're unemployed but seeking work, we can cover you with the individual plan. We can also cover some college students under the individual plan. And there are even some individuals with disabilities with what we call a ticket to work that we can also cover. That's the thing. Insure Oklahoma is a great program, and we try to make it available to as many people as possible. And it's so hard to get into all those details in just a short amount of time. So we want to make sure that people have access to our resources. And we actually have a lot of information on our website, insureoklahoma.org. We also have a toll-free number, so if a person wants to call and talk to a live person. Because what we learn is every family is different. Every situation is a little bit unique. And so the way to qualify for this is you have to meet a certain income guideline. So for a family of 4, we may, we'll say, well, you can't make more than $50,000 on a family of 4 in order to qualify. Well, we don't want you to disqualify yourself. If you think you qualify and you're close, go online and look for that information. And if you can't see that information, there's an application online and there's numbers to call, because we want you to make sure that you have every opportunity. We know that we have a lot of farmers and ranchers in Oklahoma, and there's opportunities for them to participate as well. Those get a little bit more complex because they have equipment they have to depreciate. That also sometimes impacts their financial eligibility, but they may have employees that may qualify too. So there's a lot of opportunities to qualify either as an individual or as an employer, and we want to make sure that we get that information out. I will also mention that it's very important the one thing that's been great about the development of Insure Oklahoma, we've built fantastic relationships with insurance agents all over the state, and we have insurance agents in nearly every community that are very familiar with Insure Oklahoma, can actually help people navigate the system, because unfortunately health insurance itself can be a very complex deal. We try to make it as simple as possible, but we want to make sure that people have the right information, and the reality is everybody's situation is a little bit unique, and we want to make sure that we have somebody navigate them along the way, and local insurance agents are a great resource for that.
And we do have staff at Insure Oklahoma who can help answer questions about eligibility as
Absolutely.
well.
Absolutely. We have staff on site and that answer those phones and answer all those complex questions. Make sure that, once we get people into the system, into the program, that they know how to utilize the program too. So yeah, absolutely. From start to finish, we can get information either out through the community or through the agency itself. We're going to make sure that people have all the information they need to make sure they can navigate the system and hopefully get them interested.
So if someone needs health insurance now, can they sign up now, or is there a special enrollment period?
Right. There's not a special enrollment period. You can sign up anytime during the year, and during this, so when you sign up, I think it's usually 30 to 60 days before coverage usually starts, depending on what program you come into, and making sure that the premiums are paid. The other thing I like about this program is, again, with no enrollment period, so we don't have to worry about that. We make the cash flow simple for businesses. One of the things we heard from businesses early on is they said, we can't be out a lot of money while we're waiting for the premium assistance check to come in. And so they're able to give us an invoice, and we're able to help them with the state's portion of that cost, give them that funding so they can go out and pay that invoice on time. So that's very important from a cash flow standpoint, to make sure the business is not floating the cost of this program. So we try to make it as easy as possible under the circumstances, to make sure that we're buying good insurance for qualified Oklahomans, making sure that we have every opportunity to make it easier for the business. Now, the kind of employees we're talking about, again, we're talking mainly working Oklahomans. There are an opportunity for those individuals that aren't working but seeking work, but we're talking Oklahomans 19 to 64. You need to be an Oklahoma citizen, and you also have to be an Oklahoma resident, and you also have to be a United States citizen. So there are some parameters to that, but again, we want to make sure that people are aware. Insure Oklahoma is open for business, and we're ready to take on thousands of more people.
Great, great. Is there anything else you'd like to add about Insure Oklahoma, or is there anything that's important that people in Enid particularly should know?
Well, I think the one thing is, out of fairness, Insure Oklahoma, as has been on this kind of teeter-totter for the last couple of years, we've been negotiating with our federal partner on making sure that we can keep this program funded, and I'm confident that we can keep it funded long term. So we want people to look into the program just to make sure that if it's available for them, we want to make sure it's available for them. I would love to cover as many people as possible, and for part of it is I want to make sure that there's no misinformation out there that they think Insure Oklahoma is going away anytime soon. Insure Oklahoma is open for business.
Great, great. And all that information is on our website at www.insureoklahoma.org. Thank you so much for spending time with us today, and please contact us if you think that Insure Oklahoma may help you meet your health coverage needs.
If you keep tanning, indoors or out, the effects of harmful rays will show up on your skin. Wrinkles, age spots, and an increased risk of skin cancer, including melanoma, the deadliest form of skin cancer, and the second most common cancer in women 15 to 29. Stop tanning. Time may not be on your side. Learn how to protect your skin at spotskincancer.org. A message from the American Academy of Dermatology.
Lazy bones, loafing through the day. You always seem to find the easy way, moving like you're rolling away. Never heard a word I say.
All over America, entire families are backsliding. We're no longer just sedentary, we're stationary, and that's bad news for your bones. At any age, bones need weight-bearing activity to grow strong and stay strong. So go outside, take the steps, play with the dog. Just get up, get out, get moving.
Never keep your bones that way. Never heard a word I say.
A public service message from the American Academy of Orthopedic Surgeons.
Trisha's having a sleepover tonight. Can I go?
I wonder about Lucy's friends. What should I say? I know you're only 10, but one of these days a friend will offer you a drink. And alcohol at your age can lead to so many things. None of them good.
So can I go to the sleepover?
Lucy, I want you to promise me
I
something.
finished my homework.
Bigger promise. If there's any drinking, I want you to say, "No thanks, not my thing."
Mom.
I promise you, your real friends won't care. Deal?
Sure.
Really?
I promise, Mom.
They really do hear you.
Did you pack your toothbrush?
For tips on how to start the talk, visit underagedrinking.samhsa.gov. A public service message from the Substance Abuse and Mental Health Services Administration.